So,
In my practice, I treat mostly pain
mhm.
of different types, chronic, acute, and so on. You mentioned the gentleman that stood up and said his back pain was not there,
Right.
but he wasn't doing local treatments for pain with Alpha-Stim with a pain module. It was strictly just the cranial stimulation, correct?
Correct. And to be clear, we're not, CES isn't cleared for pain in the US, it is in Europe. Um, so that is off label to use only the ear clips for pain. I was trying to treat his anxiety, and the pain was just kind of a nice little benefit, the pain relief.
Right. So
So,
his pain then perhaps was something brought on by muscular tension from stress and what have you. And when he felt more relaxed, perhaps more endorphins were being released, and that kind of there was no
definitely,
follow up.
yeah, definitely a an increase in endorphins. We've seen that not necessarily with Alpha-Stim, but with CES technology in general. But also, pain is processed in the brain. And so by balancing the central nervous system, we help modulate that pain response. So we calm that area of the brain down and the sensation of pain goes away. Um, Cognitive behavioral therapy for chronic pain research shows about 84% of our perceived pain has nothing to do with the severity of the injury and everything to do with the value we give it and how active our brain is in processing that. So by calming that down, just doing that alone, we're able to alleviate a lot of people's pain. But once you do the local treatment with our smart probes or our AS trodes, I've gotten people with severe chronic pain, when I see them and I'm treating them and they'll rate their pain at a 7 out of 10, 8 out of 10. Then I'll do a probe treatment, usually less than 5 minutes, more usually around 3, and their pain levels are 2 or below. And then you follow up with the ear clips to get a complete, not just peripheral nervous system, but central nervous system treatment as well.
That was my question next on that. If you're doing local treatment, say you have elbow pain or knee
Mm-hmm.
pain, and you're doing a local treatment, what is the mechanism for that to relieve the pain?
Okay. That mechanism is called microcurrent electrical therapy. It's the same with Alpha-Stim. It's the same waveform that we use for CES for the brain. It's just delivered in a different way. And so we put the same waveform into the nervous system. If you're using our smart probes, then it's 10-second increments. And then the device actually waits for you to make a new connection with the skin. And you're just treating all around the area of pain. And it's the same process as with the nerves in the brain. You're just balancing out that nerve signal. So, instead of the pain signals firing, and being very, very hyperactive, you calm it down. And a lot of times we see a reduction in inflammation because the body is able to kind of relax and start, kind of working on that area the way our bodies are designed to. Oftentimes we see increased range of movement and definitely reduction in pain.
Is this mediated by through C fibers, or what type of nervous fibers will be involved in making that connection afferent towards the brain? It's obviously not just be a local cellular reaction. There must be some type of nervous pathways like C fibers or
Yes. So yeah. So we
delta.
follow the nerve. So you follow, the electricity follows the nerve pathway, and just like electricity, getting in contact with the wire, it travels in any direction that wire is going. And so the same is here. Once you get the probe on the skin, the current goes down down to the nerve cells, and it travels. So you treat your left knee, for example, that current is not just staying in that area. It's following a nerve pathway up through your spine, making the cross going into the opposite side of, the opposite hemisphere as signals do. So that's why, when you're doing an Alpha-Stim, a local treatment for pain, you don't just want to treat the side of the body that hurts. You want to treat both sides because you want to get that balance. So you want the signal to go to both hemispheres of the brain. You want all of the nerves to be, sending the same signal, which is that, everything's functioning the way it's supposed to.
So I would think that this will happen more through the more myelinated type of fibers than the non-myelinated fibers. The electrostimulation, would that be enough?
I would think so. We don't have, data down to that level. Wish we did. We're as we get more and more sophisticated, we're going to do better and better studies. But yeah, so that would, just knowing the way, nerve fibers work, then I would say you're probably right on that.
Yeah, we have the whole gate theory.
Yes.
At the segmental level and so on. So, like in chronic pain, oftentimes the patient develops central sensitization, and the threshold for pain lowers, and any kind of stimulus is going to feel very magnified, allodynia type of thing. Is that when you would then consider including, not so much to treat the pain, but including the cranial approach along with the local?
Well, you always do CES when you're doing the MET treatment. It's always there's 5 steps in an MET treatment, and the ear clips CES is always number 5. The first is to do kind of a big X. So, if we were to treat my arm, I don't know how well you can see what I'm trying to do.
I can see.
You would put a probe like here on the shoulder and then down here to this wrist if we're treating my elbow. And then after 10 seconds, you would switch it so that you've got that X. Okay. Then you would zero in on my elbow, and you always want the probes on opposite sides. So you'd put one here and one here. And then after 10 seconds, you would move and do the opposite side, the opposite X. So I like to do like a small X and then across. So it would go through this way and then above and below. And so that's step 2, that small star. Step 3 then is to do a small X on the opposite elbow. That way you start getting that balance and start getting the signal sent to the opposite hemisphere. And then step 4 is you connect both sides. So you would put a probe on the tip of each thumb, index finger, so on and so forth, to connect both sides, get that current going up one arm, across the spine, down the other arm, and then back. And then step 5 is the ear clips.
Interesting. Any studies done on the treatment of phantom pain with Alpha-Stim?
Not studies, but we have some clinical experience in treating phantom pain. And it works really well because, again, we're just calming down those nerves that are firing, and basically phantom pain is the nerves firing, going, hey, something's supposed to be here. So it feels like something is there. When we get those calmed down and they're functioning optimally, then that sensation goes away.
Interesting. I use a mirror sometimes.
And I actually was speaking to someone yesterday at a clinic, and they were talking about using a mirror to treat that phantom pain, and put the mirror up and say, okay, wiggle your toes, and the perception is you're wiggling the toes that aren't there anymore. And it was an interesting discussion.
Yeah, it is. And I have seen interesting results. Not always, but a few times I was blown away by how the patient felt afterwards. And I mean, you try whatever you can to help a patient. Exactly. And even if it's not something that has been empirically observed to work, you try things to help. And I did see that make a difference. I didn't do Alpha-Stim, but other modalities, but it did make a difference. Let me ask you something about depression, anxiety, and insomnia, for which the unit has been cleared.
Right.
When I use my unit, it's not upside down. I don't see any settings for each individual condition. So would you say that what Alpha-Stim is doing is targeting regions in the brain that has large neurological real estate upon which all of these conditions arise? Because, you have anxiety, which may be having something to do with adrenaline, epinephrine, while another situation may be deficiency or not enough serotonin. We'll discuss that in a minute.
Yes.
So there is no setting. Are we saying that one size fits all with this?
It's not quite one size fits all, but the differences are in the individual, not in the indication. So, and I don't know what settings you use with yours.
I don't have any settings. All I really have is the current.
Current, yeah, that's what I
increase.
meant. The current
all
and
right,
the time.
right, got it, right.
So to treat all three of these indications, anxiety, insomnia, and depression, what you do is you put the ear clips on, put the conducting solution on the pads, put the ear clips on, and then turn the device on, turn it up slowly until you feel a little bit lightheaded or dizzy, like you
Right.
just, like you stood up too quickly, that kind of, whoa, I'm, not like you're about to pass out. It's not that strong, but it's just kind of that, oh, whoa, lightheaded feeling, or an unsteady feeling like you're standing on a boat in the water. Some people even physically kind of rock back and forth when they hit it. It's not a subtle feeling. A lot of times when I'm showing somebody the Alpha-Stim the first time, and and I'm telling them, okay, turn it up till you feel that. You can tell they're really focused. Am I feeling it? Am I feeling it? And I'm like, you don't have to do that. You'll notice it. Everybody's threshold for that is different. So some people like me can't even do 100 microamps, which is a 1 on the screen with the ear clips. I actually have to use the AStrodes and put them on my shoulders and get my treatment that way because I get dizzy even at a 1. Other people can go all the way up to 500 microamps and not feel the dizziness, not feel anything. So for the people who can only tolerate between 100, 200 microamps, they'll need to treat for 60 minutes. For people who can tolerate 250 microamps or higher, and we don't really recommend going higher than 400 microamps. There's not much clinical benefit to that last 100 microamps. You just burn the batteries down faster. So, the recommended range is between 1 and 400 microamps. Between 250 and 400 microamps, you generally only need about 20 minutes for a treatment. So that's where the difference comes in. But it does treat anxiety, insomnia, and depression all at the same time. So, and again, it does so by just having this global effect on the nervous system. So when the ear clips are on your earlobes, the current travels along the 8th cranial nerve through your inner ear to your brainstem. And then once it hits your brainstem, it spreads to the entire brain. And so any part of the brain that's hyperactive, which you see with anxiety, you see with chronic pain, and like I mentioned earlier, you see with some symptoms related to depression, then it calms them down. Any areas of the brain that are underactive, it brings them up. And so you just get that balancing. Unlike a medication, a lot of people are like, well, if it treats insomnia, it must make you fall asleep. It actually doesn't. But sleeping well is part of a healthy functioning nervous system. And so that's how it does that. And sometimes it does it the first night. Sometimes it takes it 6 weeks before you start to really see a benefit with sleep.
On a daily basis?
On a daily basis. Mm-hmm. So
let me backtrack a little bit back to the VA because I think it's good to know. Does the VA cover this for the patients, for the vets, or they have to buy it themselves?
The VA covers it. Of course, the saying is, and anyone who's been affiliated with the VA always smiles when I say this because I heard it from them. If you've seen one VA, you've seen one VA. So I was fortunate. The Central Texas VA system, once they kind of, they had it for a few years before they really kind of found where it fit. I think they tried it with neurology for a while. They put it down to their primary care practitioners for a while. And then I was able to get mine through a pain management pharmacist who worked for mental health. And he recommended to his leadership to our leadership, I also worked in mental health, that I be allowed to use the device in my clinic because I was sending everybody to him. So he was like, hey, Dr. Briley needs one so that I can treat someone other than my Brownwood, than his Brownwood patients. Brownwood was the little town I was in. And so once they found where it fit, then, more providers were able to use it and get it to more veterans. I know the North Texas VA system, my dad's a veteran. He's in that. To get his device, he went through, I believe, pain management, and his physical therapist showed him how to use it and ordered one. So it's, every VA is different, and some VAs don't want us in there. So we're in about 75% of the VAs in the country. We're on the federal supply schedule, have been since 2005. So really any government agency can order an Alpha-Stim for their people.